Thank you so much for being here this evening. This is quite a turnout, and I've been so impressed by the interest in Liberia and in addressing the Ebola situation in Liberia. And I must tell you that I had a PowerPoint presentation prepared just in case, because James is here for a very limited time. His flight arrived at 4:30 this afternoon, and he's going to be heading out in the morning. So we really appreciate the sacrifice that he's made to come here this evening. But since he's here, they didn't want me to use my PowerPoint presentation for the sake of time. But the Alaska Medical Mission has been a tremendous resource. It's amazing how a small organization can have such an impact, and you wouldn't even realize it. But because of the supplies that go to people who are doing crucial work in different places, you're going to have long-reaching impact. We were hearing about Ebola, the Ebola crisis every day, and there's a lot of concern and there's a lot of fear and a sense of hope, of helplessness. But by supporting an organization like this is a way that you can help. I was approached by a physician a couple of months ago who said that we should really ban people from going to West Africa where this Ebola crisis is, because we're just risking contaminating ourselves and having this become a global problem. But we live in a global village. We're all connected. And let me tell you something, if that process isn't contained there, it's going to get out. I mean, you can't keep people constrained in one place. And if we don't have travel back and forth and leave people there isolated, it will essentially be a death sentence, because the capacity there is completely overwhelmed. There is no way that they can handle that situation without outside help. There's no way. And if you don't have people going back and forth, you don't have personnel, you don't have resources, then the exponential growth is going to increase, and people are going to be desperate, and desperate people will get out. It's going to spread. So, well, that's the selfish aspect of it. But the other reason to help is it's just the right thing to do. You know, it's just the right thing to do. I can't help but think about Jesus when I hear people wanting to. I mean, people are afraid of persons traveling to anywhere in Africa, whether there's Ebola there or not. They don't even want them to get near you. But I just remember the stories about Jesus embracing the lepers. I mean, those were sort of like the Ebola people of that time. But we are our brother's keepers, and it's the right thing to do to help others. Now let me introduce my cousin. You want to hear him? I was asked actually to be the keynote speaker here, but I said, hey, George is a force of nature. Please give a round of applause to George. George Stewart has done a significant amount for Liberia. It was such a great thing for us to go together and for him to see the need there, because Liberia has been on his heart. And he was really at the center of that project and getting the containers over to Liberia when that was done by AMN. We were there with several physicians from here, a couple orthopedic surgeons, Doug Prevost and Steve Tower, anesthesiologists were there, and they did a tremendous amount of work. My wife, Cora Spaulding, who's a family physician, was there, but they were able to be supplied with the medical things that they needed in order to get their work done. So James Sirleaf is, he and I, we grew up together. They were my mother and my aunt together had 7 boys. And you can imagine what 7 boys growing up would be like. But I wanted to, I'm going to embarrass him here now. I wanted to be a physician, and when we were growing up, he said he wanted to be a naturalist. God. And what is a naturalist?
Dude!
Bringing back old memories. But anyway, so he eventually decided to become a physician. We both went to Morehouse College in Atlanta, Georgia. When I was a senior, he came over as a freshman, and we shared a studio apartment together that his freshman year. So we have a lot of memories together. Of course, we're both in medicine. But after Morehouse College, James went to medical school at Meharry in Tennessee. From there, he trained at the New York Metropolitan Hospital in emergency medicine, and subsequently was at a Yale-affiliated hospital in Connecticut, where he was assistant professor, and he was there for about 15 years before he moved to his current position. But in that time, James has organized and has done some pivotal work in Liberia with the Heart Organization. George mentioned how rudimentary things seem. You know, the country, and I'm not going to steal his thunder, but the country had the infrastructure devastated, but it was just down to very basic. But because of the work that James did, they were able to get personnel going into the JFK hospital and get services there that hadn't been there for a long time. Because of the work that he did, there are several hospitals and training programs that were regularly sending residents, fellows, and attending physicians to man the emergency department and provide services on the hospital and provide crucial medical personnel and training for the physicians and physicians' assistants at the JFK hospital. And that significantly enhanced the quality of care at the JFK Medical Center, which is the tertiary hospital in Liberia. So James has done a tremendous work, and I'm so glad that he was able to come and speak to you and just give his perspective on healthcare in Liberia and the response to the Ebola crisis. Ladies and gentlemen, Dr. James Sirleaf.
It's an honor to be here. I don't know if my mic working. It's really an honor to be here because all I do for Heart is what you do for me. What you people, the president tells me they're not supposed to do it, you're supposed to do it. So it's a privilege and honor to be here with you because you're the people who help us to serve the Liberian population. Let me say, Heart will probably not be here today, once again, if it wasn't for George. I remember in 2006, I'm an ER physician. I knew nothing but global health, like the rest of us. Walked into the JFK Medical Center. George was sitting there. George, remember that? And he said, oh, you know, we got to get some teaching going on here. I said, George, you're right. I said, but how do you just come on? He said, well, you know, you got to come and you got to teach. And George, I'm serious. That had probably inspired me into starting Heart and getting my colleagues and whatnot to bring physicians to Liberia. What I'm going to try to do tonight is give you some background on Liberia, if I can get the pointed thing right, about what it is, where Liberia is, and some of the stuff Heart to do, what Heart has done. Liberia simply stands for the sweet land of liberty. This part of this presentation was made from Liberia to South Georgia, Ebola. For those who don't know, Liberia is on the western coast of Africa. Is this the pointer? Small place, but when you consider Africa as a whole, it's about the size of Nevada, okay? There's the capital, Monrovia, named after President James Monroe, so it's very close to the US. Just another map, the political map of Liberia, where they have the counties and whatnot, and I'll talk more about this. They have counties who have superintendents who are appointed by the president, like the states here. It's, as I said, on the western coast of Africa, Africa's oldest republic. Some people think Ghana is, but Liberia actually is. In 1847, ex-slaves formed the country from South Carolina and Georgia. But an organization called the American Colonization in the Yale. If you go to New Haven, there's a grave of a guy named Jehudi Ashman. He's buried in New Haven. And he was one of the abolitionists. When I lived in New Haven, my dad found it. I went out and saw the grave. This grave has been there since 1825. But like I said, slaves, the whole idea was to move Africans, ex-slaves from the South back to Africa. I'm sure some people thought we'd just pack them all and send them all back. This was in 1822. They settled on Providence Island. People been to Liberia. This was the slaves first settled right outside Monrovia. It's a representative democracy, just like the U.S. It has three branches: legislative, executive branch, and judiciary branch. The official language is English, but when you get there, the English to speak, you have to kind of get to understand it, a lot of lingo. And one of my favorite things is that the flag, Old Glory, I'll show you, it looks like Old Glory. The politics and economics, the key here was dominated by these ex-slaves that moved back. There were people there. It's not that these people just, there were people there, and that's led to a lot of conflict in Liberia. I like this picture. Who recognizes this? I show this to my American kids and like, oh, look at the flag, you know, because for them, it looks like the American flag. And I always wondered to myself, did they pay somebody to do this? Because we need to check back, because you know, you got to think outside the box a little bit more. You know, oh, what are we going to do? We're going to make a flag and just come paint this thing. You know. So Liberia was dominated by the ex-slaves for 150 years after its independence. But in 1980, a master sergeant took over the country, and they killed the president. They killed the 13 of the ministers were shot on the beach, and that, to some people, think that that's what led to the turmoil and where Liberia spiraled to. The Civil War began in 1989. Dole himself was killed in 1990. In that period of 14 years, 250,000 Liberians lost their lives. 450,000 were displaced. But what was so interesting when George talks about the electrical hospital supply, which is plundered. There was no electricity when you got there in 2006. People were living by lantern. Hospitals and schools were basically shut down. I met a kid when we first started going, and I said, how long have you been in medical school? He said, 14 years. Because school starts, it stops, it goes on, the rebels come, they close it down, they do what they want to do. These are the kids that fought the war, 15, 16-year-olds, right? Wait, what does a 15, 16 understand about war and whatnot? They give him a Kalashnikov and say, oh, take this building. And he shoots his way, you know, thing. Doesn't really understand the implication. And they said one kid said he was going to go get into a building because if he could get $5,000, he could buy a plane and fly to America. Maybe he was coming to Anchorage. These are the victims of the war, right? The people who had nothing to do with the young kids and whatnot. And as you can imagine, at this time, this kid is taking his sister. But what hospital does he take her to? There's no hospital. The hospital has been pilfered, and only doctors on board with only physicians, with a few Liberian physicians working in the country during that period, 14 years. My favorite picture in the world. This is a Pulitzer Prize winning picture. Look at the dichotomy here. He has a Kalashnikov, he's about 10, 11 maybe. Kalashnikov in his hand and a pink teddy bear backpack. Where's this kid's mindset? In 1980, before the war and all that, Liberia relied heavily on exports. Its economy was on par with Egypt, Indonesia. The GDP was $1,200. The external debt was only $500 million. Unemployment was about 50%. Pretty good, sustainable economy for Africa at the time. After the war, Life expectancy in Liberia is 42. I'm an old man in Liberia, right? And I think I'm pretty young. Most people lived on $1 a day. The literacy rate was 37%, which means 63% could not read at a 6th grade level. Devastation of war. Unemployment risen to 85%. The GDP that was $1,200 was now $163, right? The national debt, the war and what people borrowed and whatnot, was up to $5 billion at the point. You know, we talk about the U.S. economy when it's at 3%, 5%. Liberia's economy during this period was negative 15% a year during this period. But 2008, things have turned around. The GDP now is 7.5%. The per capita up to $500 from $163. Unemployment is still 85%, but a lot of that because people don't have formal employment. They don't get checks from the bank every day. People get paid, you know, in Liberia term, they're hustling. So what job you doing? I'm hustling. So they're making a little money selling trinkets and things like that. Maybe George's shirt he bought, somebody hustling. Yeah, you know, he's wearing a Liberian shirt, if you didn't notice. Proud of it. But life expectancy had gone from 42 to 58. The under 5 mortality that was 25%. It was up to 76 per 1,000. But maternal mortality was still 700 per 100,000, which is still the highest in the world. Any obstetricians in the room? Talk to you later. This is some of the same statistics in 2012, give you where things have moved. This is Monrovia. You know, for people who travel overseas, when I talk in South Georgia, they think that it's just huts and whatnot. But Monrovia is a metropolis. You know, people are doing things, they're living, they're driving cars, and they're still doing that despite the crisis. Another shot of Monrovia. I like this picture. This is my family eating. Some of the doctors that go with heart to Liberia said they have had the best sushi in Monrovia. I'm serious. The fish they say is fresh. I'm not a big sushi person, so I don't eat sushi, but they say. And this is my family, my wife and my brother and family are sitting out eating sushi in one of the restaurants in Monrovia. The beauty of Liberia is green almost all year round. Rivers flow, a lot of natural resources. The sunset in Liberia. I show you these pictures with the impression of it's not just Ebola. The life is there. The beach in Monrovia. Many times, Estrada, we remember going to the beach, but this is some of the roughest ocean in the world. We weren't really allowed to go to the beach right there because the ocean is so rough. But we played here a lot growing up. The medical workforce in Liberia in 2005, 2006, in Connecticut where I'm from, there's one doctor per 350 people. In Liberia, it's 1 to 100,000. And that number has gotten worse since the crisis. This is an interesting statistic. This is data about about brain drain, basically. I think Liberia is ranked 4th in physicians that have left the country to go overseas after training. Liberia is 4th. And I can't really see the reason. Obviously, I'm guilty of it too. But you know, I trained here, and I plan to go back. That's why I did emergency medicine, because I want to do a little bit of everything. It leads the nation in the amount of nurses. Any Liberian nurses in Anchorage? We lead the world in the amount of nurses who are trained and then go overseas. Interesting data. So after the war, what are the primary health issues? Lack of access to basic, there were no hospitals. I have data in the heat of the war. Before the war, they had 400 health facilities in Liberia. After the war, in 2003, 2004, they were down to like 7 major hospitals. And lack of human resources to provide care. I think out of all the stuff that I looked at, George, thank you again for telling me that we got to train people. And this is what you've got to have healthcare workers doing what you do. A lot of institutions, the Japanese government sent ultrasound machines and things like that. Oh, we'll give you that. But who runs those things? You know, who runs even X-ray personnel was missing. Nobody during the 14 years of war was allowed to go to school. There's nobody trained, very few people trained in the nation. That's JFK Medical Center 2003. George, remember this when we got there? Looking like this. Run-down building, a lot of plumbing didn't work, the elevators didn't work. That's on a medical floor, medical bed. That's what it looks like now. I'm just trying to give some comparison, pictures for comparison. Since aid has come in and people are working now. These are the 3 ventilators in the country. Right? They finally got 3 ventilators there. You know, people now can be intubated and kept alive. I remember what we did, one of the doctors went with me, Dr. Dick Garvey from Yale went with me to Liberia, operated on a child with an encaphalocele. Then we realized that if you'd operated, you know, you had to put the child on a respirator, but there was no respirator. So the family bagged the child overnight. And the child survived. They bagged the child overnight through the whole episode after surgery. But now they have ventilators. But once again, who has a lot of expertise to run this thing? We get these things, right? I love this picture because it's the family of Liberian. This is a picture from the JFK medical ward that we helped, a pediatric ward, sorry, to transform. This lady's responsible for the 2 children, right? They're not both her kids. The other lady has left her and said, oh, I'm coming back, will you take care of my kid? So the communal care that exists in Liberia. This is a picture outside Redemption Hospital that is Hart's second project. We've developed GFK, we've got the pediatrics going, and I'll talk more about that, but Hart has contributed. But this is outside Redemption. This is an emergency department at Redemption Hospital. There's not, no monitors, no caring. And then you can easily see, I say this, how Estrada talked earlier about how Ebola can transform and take over a place like this because the sanitary conditions just aren't there. Another picture of the ER at Redemption. So let's talk a little bit about Ebola, right, in West Africa. Since the outbreak, it has sickened about 10,000 people since March, killing about 4,900 of them, making it the worst Ebola outbreak in the history of the world. It was discovered in 1976, I don't know if you know the history, but it's named after the Ebola River. Some nuns, I think from the Netherlands, were working in this hospital, and they started getting this hemorrhagic disease and bleeding to death, and their patients were doing the same thing. And when the CDC and the WHO sent people out there and investigated and found out the virus. In this outbreak, 350 people died in this outbreak. So it was nothing. They were able to contain it in the village and stop the spread of the virus. Nothing. That's what's happening in West Africa now. As I said, it's an RNA virus, and they believe the virus is transmitted by, it's in a bat that either bites animals that people consume, and a lot of the villages, they eat these we call them bushmeat. And I'm from South Georgia. I said, y'all don't laugh at these people. Y'all know y'all eat roadkill here. Come on now. Just because they eat, that's their roadkill. So bats and the monkeys and things like, the bats, the deer and whatnot, they eat and they consume it. But the problem you have, once again, is how we have the FDA stamp on meats here. When you're killing a village animal and you're not cooking it enough, you can, the blood is still there. It's potentially you'll get the virus. So this just slide to remind people that, I'll be brief. I did this slide for some medical people. The virus is not it's transmitted for direct contact. And I guarantee you, more and more you look at this, it's the volume of blood that people are exposed to that transmit this virus. It's not casual contact and things like that. But everyone you talk about who's gotten infected with this virus had a good amount of blood or body fluids spread upon them. And that's why, and I will talk a little bit about how in the US the virus has gotten to other people, some people, and not other people. But it just talks about how it may be spread by food, it's not spread by water. by consuming the meat and by blood, and bloody diarrhea and things like that, that the virus is spread. The timeline. Obviously, first discovered in 1976. There was another outbreak in the Congo in 1999, and I left out the slide. But in December 2013, they think that a child ate a piece of fruit that had been eaten by a bat. This child got the virus, right? Got sick, spread it to his family members, right? And by the time people realized what was going on, 59 people had died already in this community. This community then spread it to Sierra Leone, and then 2 cases went into Liberia. It is believed that the virus got to Liberia by people attending funerals. You see, in the West African countries, the borders are not as clear as things. You know, the people are the same tribe on both sides of the borders, so they're families. So they go and visit each other. They're not concerned about, oh, you're Liberian, you're Guinean. You know, we all have the same tribe. We visit each other. And so some Liberians went to Guinea to this funeral, and there's no embalmment. There's no funeral homes. They wash the bodies and they bury them. And the whole family is involved in that process. Right? And this does not happen in Monrovia, where they have the Anderson Funeral Home and things like that. In the villages, the people don't have that. So they thought that they washed the bodies, the guy infected and brought the virus back to Liberia. But anyway, in May 2014, their cases went to Freetown. In June 2014, the disease reached Monrovia. They thought that they had stopped it. The Liberian government thought they had stopped it, but people were able to slip out. One Liberian went into Nigeria in July, and that resulted in a death. I believe that looking at the history of this guy, the guy was running away. You know, what Estrada talks about, that is so important, trying to isolate people and then they won't be honest about their illness, their exposure. If you try to quarantine people, then they will lie about their disease and their exposures. So by August, the death toll had reached 1,000. Then the WHO said, "Whoa, this is becoming a serious emergency." 2 Americans were flown back from Liberia that had contracted the virus. It's unclear how the lady got it, but clearly, Dr. Brentley was working with patients. And I can say that personal friends of mine have gotten this virus because they were working with patients, and people who worked in these countries understand that 70% of the patients come in with a fever, right? And nobody knows, it's malaria, typhoid, which you see tons of. But how do you know when? So at the time, nobody was alarmed. They thought they were treating malaria and typhoid and exposing themselves to these patients. And people ask me, oh, well, how come they didn't protect themselves? They didn't know. They were going to work every day. I know my friends Brisbane, Dr. Brisbane and Bubba, who died from the virus, bless their souls, went to work every day and dealt thinking they were treating malaria, which they knew very well how to treat. So in September 2014, Liberian president asked for assistance. There were 3,000 troops now preparing to some of them have arrived in Liberia. And Thomas Duncan came to the US in September. That caused all the alarm. It is clear if you look at it, Thomas carried a woman who was ill. People think she was pregnant, and that's how he got blood on him. But as I'll show you later slides, the government is not a free-for-all to get on a plane. If you're sick in Liberia, I've been through the screening to try to get on a plane from Monrovia. They ask you detailed questions about where you've been, right? And they check your temperature. They pull people off planes, and not allow them to travel around the world if the government feels they need to be quarantined. So these countries are working to try not to let the virus spread. Let me show you. This is a data of October where the hotspots were. I'll show you an updated one, once again, where the hotspots are. This is Mr. Duncan's travels. So Mr. Duncan went through Europe, right, to New York, and despite he knowing he had risks, he hung out for about a week or so in Dallas with friends and family and didn't say anything till he got a fever. Then he went to the ER. Any ER nurses in the room? But I'm an ER physician by training, and I know how when it's busy, the ER nurse who's supposed to move the place, they come to you and say, get this guy out. There ain't nothing wrong with him. And probably that's what happened that night. Duncan had a low-grade fever, right? And he wasn't really explaining. He probably had a little Liberian accent nobody understood. And he got moved through the system, right? He got moved through the system without clarity. And that shows you, once again, as physicians, we've got to listen to people. Sit down and talk. They always talk to us about that, but sometimes get busy. And I think that's what happened in this case. This is what they're doing. They have these thermometers, the infrared thermometers, that they can take your temperature. I've seen it work. Take your temperature from about 3 feet away to beam this thing to you. I showed this picture in Georgia. It tells us, shoot, somebody's going to shoot somebody. I said, no, this is the thermometer. This is just the CDC guideline about knowing facts about Ebola, how you catch it, what the risks are, and basically it talks about people who, low risk are people who went to West Africa, right, never came in contact with patients, never worked with any patients, right? They're still low risk people. People who are higher risk are people who worked with patients, and then the highest risk are people who got a fever. Those people, I think Dr. Bernard said earlier, clearly, if you look at Duncan's travels, if the disease was so contagious, his family didn't get sick. They've broken quarantine. The people he lived in an apartment with weren't sick. It was the healthcare workers. And no one said it, but I bet money that it was not even the ER people that got sick, but the people working in the ICU who were doing dialysis and intubating this guy that got sick. So that tells you right there, to transmit the disease, what people have been saying is that you've got to be pretty sick and with a lot of blood and things that you transmit this disease. The early symptoms, fever, headaches, the diarrhea is what I'm concerned about, the vomiting, where you expel a lot of bodily fluids onto somebody. And the stomach pain, bleeding, again, is what's hemorrhagic fever. This just talks about this is the CDC slide that talks about how do you get, facts about Ebola, what the true facts are, right? You can't get it through water, you can't get it through the air. I get the impression listening to some of the news that when you get off the plane in Monrovia, you just get a whiff and you got Ebola already. Jeez. Scaring people. But it's touching the blood or body fluids of a person who is sick or has died from Ebola. Clearly, if you look at the Monrovia data, right, the people who've gotten sick with Ebola are people who were taking care of bodies, somebody at home sick, because people are afraid to take people to the hospital for a reason. They understand their mindset. They just came out of war. There hasn't been that much medical care, right? There hasn't been the medical centers, just go get checked as people come in. There hasn't been that, right? During the war, people had to take bodies on wheelbarrows. There's no ambulance service where you call 911 when you stump your toes sometimes. So it takes an effort to take somebody to a hospital in West Africa. And so why am I going, grandma got a little sickness, you know what I mean? Maybe I shouldn't take grandma to the hospital. Wait, and then she begins to vomit blood and whatnot. Then you look, I'm exposed. So it's easy to see how this disease was spread under these conditions in West Africa. Could it be Ebola? This just talks about what you think you should do. I think the last time we were there, Heart people went to Liberia in late August. We came up with a format for how do healthcare workers protect themselves, right? By asking questions, more elaborate questions about what communities are you from? Have you been exposed? And the administrator of JFK told me 3 days ago it has worked. They've gotten no new cases of Ebola. Simply by asking questions, You know, we talk about in medicine, it is history, history, history. Asking people the right questions about what have been exposed to, what communities, what have they done. And most people, if you ask them the right question, you will get the truth. And then you can exclude people if they have a fever, if somebody clearly has been exposed with somebody's body fluid, has somebody sick at home, has done something with the body, and they have a fever that's a high risk. They need to go to an Ebola treatment unit. And clearly, I have friends who've survived the disease, Dr. who survived the disease. If Thomas Duncan had gotten early treatment, right? When he had a fever, he had gotten in an ER, he had gotten IV fluid, he would survive this disease. That's why all the people here survived. Because they got early treatment. What's happening in these countries is people getting late treatment. It's not that you're getting bloody diarrhea and very sick, then it's very difficult, especially if you have underlying problems. So the CDC now, because of a lot of pressure, is deciding they're going to send teams to the airport so we can feel more safe. If you land in Newark, JFK, LAX, Chicago, and there's one more, Atlanta. If you're coming from West Africa, you will be talked to a healthcare worker. If you have a fever, you'll be quarantined for 21 days. If you have some risk, they will ask you to do some self-quarantining. They will take you to the back room and ask you so George, don't wear your shirt. They will take you to the back room, they'll ask you certain questions, and then they will make a decision about where you stratify in care. What shouldn't you do for an Ebola patient? If someone, and this slide is more for the healthcare workers that I teach, that I talk to, don't start ordering, first of all, if you have somebody with a risk, put them in isolation, don't protective equipment, and then selectively decide what you will do for them. Whether we want IV, I worked with a guy who worked under, an ID guy who worked under the people in the 1996 Ebola outbreak. And he said that in some communities, you can't do IVs, you're exposing healthcare workers to too much. That you will get fluids, but you get PO fluids, right? Try to replace your electrolytes, monitor your electrolytes without doing a lot of blood exposure, and see where you go. That's where it's been treated, rather than exposing healthcare workers. Liberia's lost 200 and something healthcare workers trying to combat this disease because they didn't know it, or they're trying to save somebody's life. Know the countries, right? Most of us in the room know the countries: Liberia, Sierra Leone, and Guinea. I heard the other day one guy from South Africa, if I get the point of the right. Anyway, South Africa, which is probably from here to Seattle, that or further, right? Got airsick on a plane. They said, "Where are you from?" He said, "Africa." Pulled him off and put him in quarantine. Know the countries, right? I just have to tell you a funny story. I was working at Bridgeport ER one night, and there's a small country near Spanish Sahara. They speak Spanish there. So the triage nurse asked the lady, say, "Where are you from?" And Africans typically say that because people don't know the country. Say, "Where are you from?" She said, "I'm from Africa." And the woman was speaking Spanish. But the nurse didn't understand and said, "Oh, okay, well, maybe we'll get James to translate." So know the country, have an idea. If you don't know, say, "Are you from West Africa?" This talks about how to screen people, but some of the stuff we talk about, asking the right questions: where you're from, where have you traveled, who you've been exposed to, whatnot. And this is just a triage process. Slide can come out good. These are new CDC guidelines. Rigorous repeat training. Now we're really going to train people. And the way that CDC is talking about doing this is to get people, to train groups of people to prepare for the outbreaks. I know all the ERs now, our ER, and I'm on the task force, are preparing these stringent guidelines. If anybody from West Africa has a fever or come in with some exposure history, they're going to move them in isolation and call the CDC, and then they're going to do these full-grown PPEs, and then And then they have to work in teams to monitor each other, how you're putting on the gown and whatnot. This is, I think, Dr. Gwendigal, the Minister of Health, in an Ebola treatment unit. Yeah, it was full. This is what the garment looks like. This is the full mask, the respirator, and this is one that somebody in Europe on the net has been selling. This is the new guidelines from the CDC about how they're going to go. They've gone to the full mask, full gloves and boots, fully covered equipment, rubber, fluid, which I think is good. I think it's not unreasonable if you have somebody who potentially has a fever from West Africa. I think there's nothing wrong with garning this thing like that, this spacesuit, to protect yourself. I don't think there's anything wrong with that. Well, how are we going to break this, to break the epidemic? Right? 5 ways people say there has to be more treatment centers. I think the U.S. military went, and their strict job is to build treatment centers. Move people into treatment centers. I think the height of the outbreak in mid-September, there weren't enough treatment centers. So people were coming, and the treatment center, I know the JFK treatment center was built for 25 people, and they had like 60-something people there. So there weren't enough treatment centers. They're not talking about home care. One of the things I talked to task force about is that, okay, if we don't have enough treatment center, we're going to treat you at home, but we're going to protect ourselves. And getting people to understand that kind of protection and why it's being done is not that I don't love you, but in that community of West Africa where people hug and whatnot, that's what they do. If I can't if there's no hospital to take my grandma or mom to, I can hug her, I can give her comfort, and that's what they're talking about doing. An air bridge evacuation system for people to work in these isolation units and treatment units so that people have a way to get out. If I get sick, a quick way to get out. Preparation elsewhere is what we're doing here. In vaccine, I heard on Friday they're going to start vaccine trials in Monrovia for the disease. How it works, we all hope. This is a slide of the latest outbreak. Know that it's moved, if I can get the pointer to work here. The hot spots now have moved away from Liberia and now into Guinea. And I talked to Thomas Frieden the other day. He said they're concerned now that it's moving away from Liberia because Liberia is now beginning to do a good job, get treatment centers and whatnot. And the hot spots, the more purple is the hotter spots and new cases on this map. You can see some leveling off on the total rates, and if you look at the rates from Liberia, which is the red, the red one, it's beginning to level off. That's good. This is data from last week that is beginning to level off, and hopefully begin to see a decline. But people in Liberia are beginning to be very happy about what's happening to rates now, that in fact they got treatment centers going, and people begin to understand the disease. I mean, you got to understand this community. Some people thought it was witchcraft and that kind of stuff that was leading this disease. So, and this is just another data that says the same thing, that percentage of contact became cases that if you had contact, did you become a cases? It was up to about 50% of people came in contact with anybody with a fever or was sick with Ebola, got the virus. Now it's down to about 18% in late October. Let me talk a little bit about HEART. HEART is a group I formed after George talked to me about treating health education relief through teaching. The whole concept is you can have a doctor for 12 months, or you can have one doctor. You can have one doctor for 12 months, or 12 doctors 1 month at a time, and believing that the people can give a month of their time to go and teach and work in communities, deprived communities, but they can't give a whole year. And so what HEART does is recruit physicians to come and work with us and go to Liberia, to work at JFK Redemption and teach. We've suspended operation because we don't have, I feel that we're a small operation. We don't have the evacuation that the WHO and those people have if somebody contracted the virus, to evacuate them and get them to Nebraska or Emory or somewhere like that. So we suspended operations to say that what we'll do then is to get PPEs to people in Liberia. Just gives the background of where we are. We're formed in 2006. Initially, our focus was to get supplies and whatnot, but then we decided we got to do more training for the Liberian population. It's a 501c for people who are interested in what we do, health services, education, do some research. Our objectives in Liberia to supervise direct medical care, capacity building in medical education, improve medical care, and to develop healthcare programs. Clearly, if you talk to people at JFK, we really helped to build the pediatric service, which is the best pediatric service in Monrovia. Since 2007 or so, we've put annually about 50 to 60 doctors rotating in different specialties throughout the country, especially peds, emergency medicine. And we hired the first pediatrician. I may not have mentioned, but when we got there to Liberia, had no pediatrician. There was no pediatrician in the country for a population that has 80% under the age of 20. But there's no pediatrician in the country. That's why we had high infant mortality rates. Our goals are to continue to develop programs at JFK, obviously reduce mortality rates. One of the things I want to do is to develop PA training there. I haven't been able to really get it off the ground, but if anybody interested in working with me on these, please do. And now our goal, and thanks to the Alaska Medical Mission, we're providing protective equipment. I think that's been made a big contribution to healthcare workers. Dr. McDonald told me, the other head of JFK, they've delivered 300 babies in the last 6 weeks, and no one's gotten, and for obstetrician, you know that's a very bloody procedure. No one's gotten infected because the PPEs that you guys have donated have gotten on the ground, and they're using them for deliveries. So people are going back to the hospital to get deliveries and whatnot. And obstetricians are changing these suits 2 or 3 times during the C-sections and deliveries and not getting infected. That's what's so important. What's the benefit to you if you want to tell anybody? I think absolutely it's a two-way street. Your exposure to tropical health, obviously there are a lot of malaria things. I have one of the PAs went with me to Liberia, came back, and he was working in the Bridgeport ER, and they had a guy come from India. When the guy had a fever, he was so sick, and he did a malaria spray. People are like, whoa, Tom, you're so smart. I went to Liberia for 2 weeks, man. You know, he diagnosed malaria. You know, so you learned a lot of stuff. And with travel around the world, I think Atlanta landed like 5 million people from around the world. You have to have some kind of training. It's better for you to get some training in tropical health and global medicine. You experience another culture. I think that people who diversify, you go and see other cultures, that's good. Those are the objectives. And you want to be exposed to the challenges of global health as we see the Ebola crisis and how it can affect the world now. That's my daughter. It's not a run, it's a walk. You know, it's going to be a pace. We're going to walk through this thing. Nobody's going to run. The finish not coming quickly. I predict that Ebola will probably be over in Liberia by late April, early May, but we'll work through it. We're committed to it. And I see this picture of my son. When I see him, I think about his sandcastle in the ocean. If people don't grasp the opportunity and hold on and protect these things, they will all slip back into the ocean. Liberia could potentially be right back where it started. And I leave you the words of Amber Vincent. While this day's celebration of gratitude, I ask we do not lose focus on the thousand families who continue to labor under the burden of disease in West Africa. And I say this thanks to the Alaska Medical Mission. I think that Maya Angelou, before she died, she says, I will not remember what you give me. I will not remember what you tell me. I may not remember what you say to me, but I will always remember what you do for me. And you guys have been great. You've been doing. We thank you for helping Liberia. Thank you very much.